Ministries of Health and Ministries of Finance.
Ministries of Health and Ministries of Finance determine which health services are delivered, when, where, and from whom. While Ministers of Health are responsible for setting national health policy and manage the day-to-day delivery of public health service, they are dependent upon Ministers of Finance for establishing funding levels and releasing the necessary funds to finance Ministers of Health operations. Designed for health sector managers, a toolkit for Ministers of Health to work more effectively with Ministers of Finance presents 4 different tools to help Ministers of Health staff better manage the resources and communicate more effectively with their Ministers of Finance counterparts. The 2 institutions lack common language systems, properties, and incentives. Likewise, few opportunities exist outside the high-level meetings associated with annual budget negotiations for dialogue and funding levels, multi-year funding requirements, and mechanisms necessary for improving health outcomes. The toolkit aims to help bridge the gap between these 2 important situations. The 4 tools can be used separately or together, depending on the needs of the managers.
Toolkit for Ministries of Health to work more effectively with Ministries of Finance.
In countries around the world, Ministries of Health and Ministries of Finance play essential roles in how health systems function and when how to whom health services are delivered. While Ministers of Health are responsible for defining the overall direction of national health policy and the day-to-day delivery of public health services, they are dependent upon Ministers of Finance that establish overall annual funding levels and release funds necessarily to finance Ministers of Health operations. As a result, Ministers of Finance wield significant control over the funding and budget flexibility of Ministers of Health. The HFG Toolkit presents a set of strategies, self-assessment and methodologies, and performance management present to help Ministers of Health better manage their own resources and effectively communicate with Ministers of Finance.
Guide self-assessment of public financial management performance.
Good performance of public financial management system is one of the elements of governance that should be reinforced in support of sound evidence-based health interventions. PFM performance, however, is typically assessed by considering the government as a whole rather than the individual's performance. Such important sectors of health, self-guided assessment adapts the public experience and financial accountability assessment methodology developed and implemented by a multi-donor partnership.
Developing key performance indicators.
Key performance indicators represent a point of convergence between Ministers of Health, Ministries of Finance, or where separate the central Dutch authority. This tool provides useful guidance for the health sector of developing and using KPLS and building this into the budget process, especially in offers governments manage responsible for planning programs implementations, monitors and evaluations, particularly in central or federal ministers of health. Guidelines and types of thinking strategy about programs planning, defining performance indicators, setting KPL targets, and hand-raising performance information. The tool was piloted in Nigeria with the National Agency to Control AIDS and revised based on feedback from stakeholders.
The financing of healthcare ensures sufficient resources are generated to sustain services and meet the health needs of the entire population. MSH works with governments and non governmental organizations to design and implement strategies for financing health services, including health insurances, schemes, and government budgets, and other strategies such as tobacco taxes. MSH also assists with developing resource allocation strategies so governments can spread funding equitably across programs, services, facilities, and subnational areas. A resource tracking support helps leaders and management to determine how much is being spent on health programs and services. MSH also helps stakeholders develop users' fee systems for private and public health services. This support has helped public hospitals provide low cost medicines, and it also has helped NGOs sustain service delivery without donor funding. To ensure the poor and protect, MSH incorporates waiver and exemptions mechanisms into uses free systems and publishes international guidelines to help leaders effectively implement the systems.
Healthcare, financing, philosophy.
Singapore offers universal healthcare coverage to our citizens, with a financing system anchored on the twin philosophies of individual responsibility and affordable healthcare for all. Through a mixed financing system, use of market-based mechanisms to promote competition and transparency, and the adoption of technology to improve the delivery of healthcare services. We have secured good healthcare outcomes for our population. We have done so with a national healthcare expenditure of about 4% of our GDP, which is low among developed countries, although this is expected to grow with an aging population. These features of the Singapore system have been recognized in various international assessments. We intend to continually evolve and improve our policies over time.
Universal coverage, multiple layers of protection.
We have involved a mixed financing system with multiple tiers of protection to ensure that no Singaporean is denied access to basic healthcare because of affordability issues. The first tier of protection is provided by heavy government subsidies of up to 80% of the total bill in acute public hospitals wards, which all Singaporeans can access. The second tier of protection is provided by MediSave, a compulsory individual medical saving account, which allows practically all Singaporeans to pay for their share of medical treatment without financial difficulty. Working Singaporeans and their employers contribute a part of the monthly wage into the account to save up for their future medical needs, and this is portable across jobs and after retirement.
The third level of protection is provided by MediShield Life, which has replaced MediShield from November 1, 2015. MediShield Life is a basic health insurance plan which helps to pay for large hospital bills and select costly outpatient treatments. Finally, MediFood is a medical endowment fund set up by the government to act as the ultimate safety net for needy Singaporean patients who face financial difficulties with their remaining medical bill after receiving government subsidies and drawing on other means of payments, including MediShield Life, private integrated plans, EPS, MediSave, and Cash. Organization of service delivery. Singapore today has a mixed delivery model. The public sector dominates the acute care sector, delivering 80% of the care in this sector. The primary care sector is dominated by private sector's providers, which account for about 80% of the market. In the step down care sector, nursing homes, community hospitals, and hospices. Service provisions is mainly provided by voluntary welfare organizations, most of which are funded by the government for their service rendered to patients. Promoting competition and transparency.
In 2004, the Ministry of Health began to publish hospital bill sizes to show the variation in costs among our hospitals, with a view to push our hospitals on this effort to do more with less. There have been some successes since then in spurring improvements. For example, LASIK prices dropped by more than 1,000 per eye, and the competitive price wars continue to this day, at great benefit to consumers. The ministry has also progressively published health outcomes on the website to encourage further improvements and help patients make more informed choices. Our opinion on the subject is that every country, government, and president should have a really good, stable, and perfect Ministry of Health and Finance to ensure that every citizen, even if they don't have the means to have perfect health, or if they have the means to have perfect health and pay for hospitals and doctors, can be safe if they ever have a problem with this health problem or finance. People working in this should really be adept, equipped, and never lose incentive. They have to be engaged with it so that people can have the best of the best in health and finance problems. If a ministry isn't well organized, the country could really get a bad rap and never succeed.